Now, I saw this study on push-ups in relationship to the group of people who can do more push-ups have less heart disease. It was a cohort study involving over 1,000 people, and they showed a significant negative association between baseline push-up capacity and incidence in cardiovascular disease risk for over 10 years. So they compared participants who can do 40 or more push-ups to people who can only do 10 or less push-ups. Now, personally, I don't think that being able to do more push-ups will decrease your risk for heart attacks, but I think people that can do more push-ups are more fit. Usually they're more healthy. And just as a side note, I'm very curious, how many push-ups can you do? Put it in the comments down below. I want to read that and check it out. What I am more interested in is how much did this study cost? And who pays for these studies? Because what they should be studying, which is way more important, is the causation of heart disease, since it's the #1 killer. They should be doing studies in the relationship between how cardiovascular disease starts. It starts with inflammation in the inner lining of your arteries. The inflammation develops plaquing, hardening of the arteries, and then it starts to obstruct blood flow. Now, you also have clots that can develop and cause heart attacks, which is slightly different, and those clots can break off and go right into your brain and give you a stroke. So the question is, does push-ups reduce inflammation? And the answer is, I don't think so. What does increase inflammation is the chronic consumption of refined sugar. Now, by the way, when you consume sugar with vitamins, the vitamins protect against inflammation, FYI. Not that I'm telling you to do that, but the fact is that the majority of the population is consuming the refined sugars. They should study diabetics with the amount of excess glucose floating through the inside of their arteries. I think refined oils are at the top of the list too. That's high in omega-6, highly inflammatory. Then you have refined flours, you have smoking, you have stress, and the big one is vitamin E deficiency. If you have enough vitamin E in your body, you can protect against a lot of problems in the inside of the artery simply because vitamin E is one of the most powerful antioxidants for cardiovascular problems, because vitamin E protects against oxidation on the inside of your arteries. I mean, I could probably bet that if you compared people who can do a lot more pull-ups against the group that does a lot less pull-ups, they're probably going to have less heart disease. People that can bike longer than people that can't, or people that can hike longer than people that can't, will have a decreased heart risk. Not because of the exercise itself, it's just because they probably have a healthier lifestyle. Now, if you haven't seen my recent video on reversing cardiovascular disease, I put it down below. Check it out. Hey, before you go, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below.